All right, well, good afternoon, and thank you for joining Public Health today for this media briefing. Dr. Ferrer will make some remarks, and then we will be taking your questions, and that will be followed by remarks in Spanish. If you have a question that want to be put into the queue, please click on the hand icon, which is in the participant panel. And with that, I'll turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thanks so much, Tim, and thank you everyone for joining me for today's briefing. This afternoon, I'll be talking about our trends in cases, hospitalizations, and deaths, and I'll provide an update on cases, hospitalizations, and death, both by age, race and ethnicity, and by vaccination status. I'm also going to, as always, offer an update on vaccine delivery and outreach, information about the Delta variant and post-vaccination infection cases, information today about some worksite outbreaks, including outbreaks in skilled nursing facilities, and information, obviously, about the latest health officer order requiring indoor masking. We can start with the first slide. We are continuing to see a very rapid rise in transmission countywide, with cases doubling over the last 10 days. We're reporting 2,767 new cases today. This is an 80% increase over the last week. And this does bring the total number of cases in LA County to 1,276,137. To date, more than 7.2 million people have been tested and had test results reported in LA County. Our daily test positivity rate is 5.26%. This is an increase from a rate of 1.2% on June 15th, when physical distancing restrictions and capacity limits were lifted across all sectors. Our daily average case rate with a 7-day lag is now 12.9 cases per 100,000 people. This is also a significant increase from last week's rate of 7.1 cases per 100,000 people. There are 645 people currently hospitalized with COVID-19, an increase of 30 people over the last day or two. There are currently 100 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. I'm sad to report 13 additional deaths today. 8 of the people who died had underlying health conditions, and this does bring the total number of deaths to 24,607 across LA County. We do share our deepest condolences with those of you who have lost your friends, loved ones, and family during this very difficult time. According to the CDC, this daily increase in cases to the high level where we are now puts us in the category of substantial transmission. And considering that we've reported over 1,000 new cases nearly every day over the last 7 days, the daily average case rate is at a community transmission level without considering that 7-day lag. I'll go on to the next slide. As you can see from this table, which shows the CDC indicators and thresholds for community transmission of COVID-19, as I noted, community transmission is now at a level of substantial transmission. For this reason, we issued the health officer order over last weekend that required masks to be worn in indoor public settings countywide. We can go on to the next slide. This graph shows trends in cases, hospitalizations, and deaths across the county from the beginning of the pandemic through July 14th of this year. You can see, looking at the rightmost part of these trend lines, that cases, represented by the green line, have risen extremely rapidly over just the past 2 weeks. And while cases are still at a much lower point than they were during any of our other peaks, the rate of rise is quite high. Between July 3rd and July 16th of this year, our 7-day average case number increased by 135%. The last time we saw case rises this quickly as they are now was back in early December of last year, and that was during our very worst surge. A little more than a year ago, on July 1st, 2020, we were seeing almost the same exact number of cases that we're seeing right now. However, it's important to note that the rate of hospitalizations, as represented by the orange line on the chart, was much, much higher. On that same day, we had 1,906 people hospitalized for COVID, while today, although that number is so much higher than it was a couple of weeks ago, the number is 645. We're accustomed to seeing hospitalizations rise as what we call a lagging indicator compared with cases as they increase. This is a trend you can observe looking at these at the trend lines here on this graph, both during our wintertime surge and our summer 2020 surge. Because of this lag, we still believe it's too early to say with 100% certainty whether the small uptick we're seeing in hospitalizations is the beginning of a small wave of hospitalizations or the start of a more devastating surge. We are hopeful, however, that with so many of our highest risk residents fully vaccinated, we'll not see the same rate of increase in hospitalizations that we saw last year. And while deaths, represented here by the blue line, have not yet begun to significantly increase, there have been small increases among members of some populations that we'll need to watch carefully for another couple of weeks to assess the impact of increased cases and hospitalizations on our death rate. I'll take the next slide. This slide shows case, hospitalization, and death rates by race and ethnicity from the 2-week period ending on June 12th, alongside these same metrics a month later for the 2-week period that ended on July 10th. As we've been reporting previously, over the month preceding July 10th, all groups have now seen an increase in cases, with the highest case rate observed among Black residents, whose case rate in this time period increased from 43 cases per 100,000 people to 181 cases per 100,000 people. That's an increase of 320%. We've also seen significant increases in case rates for all groups, with an increase of 182% among Latinx residents, 361% in white residents, and 371% among Asian residents. It's notable and deeply troubling that the more recent case incident rate in Black residents is more than twice that in white residents. And it's also notable that now white residents who have traditionally experienced lower case rates than Latinx and Black residents are the group with the next highest case rate. Over the same interval, hospitalization rates have been trending upward by 35 to 90% among Black, Latinx, and Asian residents. And we've also seen deaths begin again a slight trend upward among Black residents. These considerable increases are a demonstration of the increased circulation of the highly transmissible Delta variant, which I'll detail further in a few minutes. Next slide. This slide looks at the age distribution of cases over the entire pandemic. And as you can see from the latest trend lines and from the table to the right of the slide, showing rates as of July 15th, cases are rising fastest in young adults between the ages of 18 and 29, and that's indicated by the light brown line, among whom the case rate was recently about 25 cases per 100,000 people, and also increasing for those between the ages of 30 and 49, among whom the case rate was 18 cases per 100,000 people. Next slide. Here you can see the trend lines that look at hospitalization rates by age, and you'll note that the rates are higher with the higher age group, with the highest hospitalizations among people 80 and over, and that's represented by the white line. And this speaks to the higher vulnerability of older people to the more severe effects of this infection. And even with our very high rates of vaccination, older people are still more likely than others to be hospitalized with this increased circulation of the Delta variant. We'll go on to the next slide. We've been detailing the rise of the Delta variant among strains sequenced in the LA County area for weeks. The reason that we, like so many in the United States, are especially concerned about this variant is because it's more easily spread between people, more than other variants of concern. Some early studies on this variant's replication in the human respiratory tract suggest that its faster replication, higher viral load, and greater affinity for the lower respiratory tract cells compared with earlier COVID strains is making it more efficient at spreading from person to person. And while emerging data affirms that fully vaccinated people are well protected from severe infections with Delta variants, people with only one vaccine are not as well protected, and there's increased evidence that a small number of fully vaccinated individuals have become infected and may be able to infect others. This slide does show that the variants identified by both the public health lab and the group of other California labs from 9,243 specimens that were linked with LA County residents have in fact, again, continued to demonstrate that Delta variants, represented by the bright yellow bars, are in fact the most commonly sequenced variant in LA County. And this has held true since the beginning of June. We can take the next slide. This is just a trend line that shows the trajectory just of the Delta variant among the specimens that are sequenced by labs serving Southern California, including our own public health lab. The number of sequences collected between July 11th and 17th that had Delta variants isolated was 201. And that's 84% of all sequences that were collected that week. And you can see that obviously on the blue trend line on this table. This is consistent with the rise of Delta nationwide. Earlier this week, CDC estimated that Delta strains accounted for 83% of circulating COVID. Given that about 4 million residents in LA County are not yet vaccinated, the risk of increased spread of this variant within our county obviously remains high. We'll take the next slide. Because of the Delta variant's extraordinarily high capacity for transmission, we've also now begun to see a rise in outbreaks at places where people work or live in close quarters. After several weeks of very low weekly numbers of outbreaks, we've seen increasing outbreaks in settings that serve people experiencing homelessness. In the 2-week period between July 4th and the 18th, there were 22 such outbreaks. We've also seen rising numbers of outbreaks at work sites and facilities, with 8 work sites and 6 food facility outbreaks reported during this short time interval. The last time we saw upward trending rates at these levels was early in the pandemic, during the last 2 weeks of April 2020, when the rate of increase in settings serving people experiencing homelessness went from 12 to 23 in just 1 week. We'll take the next slide. We also track outbreaks in healthcare settings, which were at particularly high risk early in the pandemic due to the low availability of PPE, close contact between highly symptomatic people, healthcare workers, and others who were in the environment, and the high density of people with comorbidities in these environments. The risk profile of healthcare settings has since changed, with widespread PPE availability and vaccine uptake high among healthcare workers and people who live in long-term care facilities, including our skilled nursing facilities. And so it's notable that despite increasing outbreaks in other settings and rising community transmission, we're not seeing significant increases in outbreaks in healthcare settings, where high rates of vaccination and universal masking are in place. We can take the next slide. Between May 20th and June 20th of last year, a time during which case rates ranged between 1,500 and 2,000 a day, slightly lower than where we are now, we had 52 outbreaks in skilled nursing facilities. These outbreaks initially involved 1,350 cases in residents and 981 cases among staff. By the time these outbreaks had been fully investigated, they were found to involve 2,331 cases, 575 hospitalizations, and devastatingly, 333 deaths. This, of course, took place during a time before COVID vaccines existed. Contrast that with what we have seen in skilled nursing facility outbreaks over this past month. The 8 outbreaks identified during the same time period, as noted here, June through July, the beginning of July, involved 17 cases among residents and 2 cases among staff. Notably, we now have full vaccination rate of about 85% among skilled nursing facility staff and residents. And although our case rates have only recently approached the rate sustained during the earlier period, the number of outbreaks we're seeing and of outbreak-associated cases is in orders of magnitude very different. To date, these outbreaks have only grown to include 2 more cases for a total of 19 and have led to only 1 hospitalization, and so far, no deaths. Although we're still early in our latest case increase, these differences do demonstrate the power of widespread vaccination to prevent severe COVID outcomes, even amongst the highest risk scenarios. We'll take the next slide. It's for this reason that our vaccination efforts remain so critically important to reducing the impact of rising infection among our residents. As of July 18th, we have administered more than 10.8 million doses to residents 12 and older, including more than 6 million first doses and more than 4.8 million second doses. This means more than 6 million LA County residents have received one dose and more than 5.3 million are fully vaccinated. We'll take the next slide. This slide shows how we're doing at vaccinating specific age groups of LA County residents. As of July 18th, we vaccinated 88% of LA County residents 65 and over, 70% of residents 16 and over, and 69% of residents 12 and over. We vaccinated 39% of LA County teens between the ages of 12 and 17. And out of all of our nearly 10.3 million LA County residents, including those who are not yet eligible for the vaccine, 52% are fully vaccinated and 59% have received at least one dose. We'll take the next slide. We do continue to vaccinate Angelinos at low but steady rates. And last week, after months, or really after weeks of steadily declining weekly vaccination numbers, we saw an uptick in first dose recipients. Between July 12th and the 18th, we administered just about 57,000 doses across the entire county network. That was an increase of about 2,000 from the previous week. And as we know, those numbers are likely to go up as we get complete reporting from all the sites. We are immensely grateful to everyone in this county who's done and continues to do their part by getting vaccinated and by helping to educate family, friends, and neighbors and coworkers about vaccine safety and protection. Our sense of urgency to increase vaccination among our residents remains high, and we're glad for any signs of increased vaccination uptake. We'll take the next slide. We nevertheless continue to have large gaps in vaccination between age groups and racial and ethnic subgroups. As you can see on this slide, we continue to see gaps among teens and younger adults. Among both the 12 to 15 and the 16 to 17 age groups, about 1/3 to 1/2 as many Black and Latinx teens, and about 2/3 to 3/4 as many white and American Indian, Alaska Native teens are getting vaccinated as their Asian counterparts. This data also shows significant gaps among young adults, 18 to 29-year-olds. 29% of Black adults in this category and 44% of Latinx adults have been vaccinated, compared to 60% of their white and 77% of their Asian counterparts, between 1/2 to 2/3 fewer. The disproportionality also persists among our 30 to 49-year-olds. In this group, vaccination rates among Black adults are 1/3 to nearly 1/2 lower than rates among Asian and white residents in this age group. Looking at the totals by age group running across the bottom of this table, you'll note that vaccination rates are generally higher in older age groups. And with transmission on the rise, we're particularly gratified that so many of our seniors are protected by vaccines. But to really beat back transmission, we do need to see other age groups reach high levels of vaccination. It's very concerning to see gaps persist among young and middle-aged adults who are such an important part of our workforce. Meanwhile, I want to note, looking at the totals in the rightmost column, that we're seeing the lowest levels of vaccination among groups where we've seen the highest rates of transmission, hospitalizations, and now deaths. We remain very concerned about the low levels of vaccination among our Black residents and among other teens and young adults as transmission continues to rise. And we do urge full compliance with the indoor masking requirement so that we can get back to reducing community transmission numbers. Slowing the spread not only protects vulnerable unvaccinated residents, it also reduces the chances of more mutations that can result in more infectious variants that evade vaccine protection. We'll take the next slide. As always, to close the gaps, we do have to continue efforts that make it as easy as possible for eligible LA County residents to get vaccinated by offering vaccines at as many different sites across the county as possible. As you can see on this map, this week there are 771 sites offering vaccinations. These include pharmacies, clinics, community sites, and hospitals. And many of our vaccination sites are concentrated in areas that have the lowest vaccination coverage. As a reminder, you can obtain vaccines at county-run sites, at all the LA City-run sites, almost every mobile site, and many community sites without an appointment. Many sites are open on weekends and many have evening hours. So please check vaccinatelacounty.com if you need to find a site near you. I'll take the next slide. We have continued with the strategy for improving access to vaccines by having mobile vaccination teams take vaccines into neighborhoods to reach people who may have limited ability or time to get to one of the established vaccination sites. The blue markers on this map indicate the 329 sites where our mobile teams will be offering vaccinations this week. And again, these are concentrated in the higher need areas. The mobile vaccine teams continue to work with employers and community organizations to provide vaccines and information about them at convenient locations where residents gather. And as a reminder, there's a form on our website where you can request a mobile team to come to a community event, a community site, or workplace. So please, employers and event organizers, just let us know when you want us to come to one of your sites and you want to host a vaccination clinic. We do have sites that are set up at retail stores, parks, recreation centers, and lots of other gathering places all across the county, making it as easy as possible for residents to get vaccinated. We'll take the next slide. One important question we try to answer is how this increased transmission in LA County is affecting people of different vaccination status. What you see here is an illustration that, while not to scale, it's intended to try to help explain the different ways that we look at the data to answer different questions. In this illustration, the green box on the left represents fully vaccinated people, while the orange box on the right represents people who are not fully vaccinated. Meanwhile, the white boxes within and slightly overlapping the large boxes represent cases, hospitalizations, and deaths that occur in a mix of people who are fully and not fully vaccinated. One way you could look at the data, and the way we've most commonly looked at these data during the past press briefings, is by looking at all of the people in the green box of fully vaccinated folks and counting the number of people in the white boxes, counting COVID cases, hospitalizations, and deaths among this group of fully vaccinated people. And by analyzing this data, we're able to see how well vaccines protect the people who receive them. However, it does not tell us what proportion of cases, hospitalizations, or deaths are among fully vaccinated people compared with the proportion of those same outcomes that are among non-fully vaccinated people. To be able to answer what proportion of our outcomes are happening in fully vaccinated people compared with people who are not vaccinated, we can instead look at all the people in each of the white boxes who were identified as cases, or they were hospitalized for COVID, or they died from COVID, and who are made up of a mix of both vaccinated and unvaccinated people. We can then count up the number of fully and non-fully vaccinated people in each group, and for each outcome, we can compare what proportion were fully vaccinated or not. The next slides are going to look at the data in these different ways to try to answer the different questions. We'll go to the next slide. First, in this calculation of the proportion of fully vaccinated people who test positive for, are hospitalized for, or tragically pass away due to COVID. This graphic, which has previously been shown, presents these numbers in LA County, and please note that the circles are not to scale. Looking at positive tests in the group of more than 4.8 million LA County residents who achieved full vaccination status from the time we began vaccinating in December through July 20th, we identified 6,520 people who tested positive for a COVID infection contracted more than 2 weeks after they were fully vaccinated. And I do want to note this is an increase of 58% from the approximately 4,100 post-vaccination cases we detected last week. This new number translates to 0.13%, 13% of fully vaccinated people who have tested positive, and that's up slightly from last week's 0.09%. The rise in hospitalizations among fully vaccinated people was much smaller. We went from 213 hospitalizations to 287. That's from about 0.0045 to 0.0059% of all fully vaccinated people. And deaths in this group also increased much less dramatically, from 26 to 30, again with the increased vaccinations. And it went from 0.0005 to 0.0006%. Next slide. Now we can also look at the spread of fully and non-fully vaccinated people among cases. This bar chart shows the proportion of each month's positive COVID test results in unvaccinated and partially vaccinated cases. That's represented by the orange portions of each bar, and the proportion of positive test results in fully vaccinated cases, and that's represented by the much smaller green slices that you're seeing at the top of each bar. Since February of this year, when fully vaccinated people made up fewer than 0.5% of cases, the number of total positive cases has dropped substantially as millions of residents were vaccinated. Meanwhile, as more people have gotten vaccinated, the proportion of total cases that are among those vaccinated has slightly increased. This is to be expected because as more people are vaccinated, the number of fully vaccinated people becoming infected can increase. In June, fully vaccinated people represented 20% of all cases diagnosed amongst LA County residents, while unvaccinated and partially vaccinated people accounted for 80% of the cases. I want to sort of explain that if the 50% of our residents that are now fully vaccinated were not vaccinated, not only would the green slices not exist, but the orange portions of these bars would be much larger. They'd perhaps double in size because everyone would have instead the same risk of infection as unvaccinated people do. So while our numbers have been going up, they would be much higher if we didn't have as many people fully vaccinated. We can go to the next slide. This graph, which is updated from what Dr. Davis showed last week, shows case rates among vaccinated and unvaccinated LA County residents. As you can see, over the last few weeks, case rates have risen precipitously among unvaccinated people. And while cases are also rising among vaccinated people, the increase is much smaller and much slower than it is in unvaccinated people. Unvaccinated people have more than 5 times the risk of becoming infected than vaccinated people. Our county's case rate would be likely much higher if we didn't have so many vaccinated people. So again, I want to note that we're extremely grateful to everyone who has helped reduce potential transmission by getting vaccinated. We can go to the next slide. On this slide, you'll see the monthly rates of infections, hospitalizations, and deaths per 100,000 people among fully and non-fully vaccinated people over the month of June 2021. Over the course of this month, the infection rate among fully vaccinated people was about 27 infections per 100,000 people, while it was 125 infections among people who were not fully vaccinated. We saw similar differences in the magnitude and hospitalization rates, which were about 2 hospitalizations per 100,000 fully vaccinated people and 11 hospitalizations per 100,000 people who were not fully vaccinated. And the pattern persists in deaths, where the rates were 0.1 death per 100,000 fully vaccinated people compared to 0.9 deaths for every 100,000 non-fully vaccinated people. This past year and a half taught us to fear the kinds of increases in COVID cases that we're seeing now, because waves of cases have always translated into waves of hospitalizations and deaths. And it's not yet clear that we're going to see that same pattern with this wave, in part because we as a population are very different. More than half of our county's residents, including those most vulnerable to the worst effects of the virus, are now fully vaccinated. And what we're seeing in other countries with similar rates of vaccination that have been experiencing a surge in cases attributed to the Delta variant, where widespread vaccination looks like it's disrupting the usual pattern. In the United Kingdom, where 54% of the population is fully vaccinated, 700 cases are being diagnosed daily. And that's within striking distance of the 800 daily cases that were seen at the peak of the country's wintertime surge. And yet the nation's death rate is almost 1/30 of what it was at the nation's peak, and hospitalizations are also relatively low. In Israel, where 58% of the population is fully vaccinated and daily cases have risen exponentially since mid-June, daily deaths remain in the low single digits. Some level of community immunity seems to be protecting people in these countries as a whole from the kinds of mass tragedy we all witnessed earlier in this pandemic. And that is hopeful news. And it's further proof to us that increasing vaccinations to as high a level as possible is our best way to get back to very low rates of community transmission. Next slide. And while there's ample proof, and I've shared a lot of it with you, that vaccines remain our most powerful tool to reduce spread of the virus, the Delta variant, because it's so much more infectious than any other virus strain we've seen, requires us to add additional layers of protection to slow transmission as we're working to increase our vaccination rates. Not only is the Delta variant much easier to transmit to others, included to those who are fully vaccinated, but along with this increase in community transmission comes the threat of new mutations that may be even more dangerous than the Delta variant. That's why we're asking everyone to wear masks. Masks are an important additional layer of protection that makes it harder for there to be transmission among both unvaccinated and vaccinated individuals. Vaccines and masks work together to protect us. If you think about this pandemic as like a weather event, vaccines are like our umbrella. Excellent protection on most rainy days. But when the rain gets really intense, for example, during a bad thunderstorm, we might also throw on a raincoat. In the same way, with transmission intensifying, we're asking you to also add a mask. While vaccinated people can be reassured about the protection the vaccine gives you from severe COVID disease, we cannot yet reassure you that given the proliferation of the Delta variant, the vaccine protects you from infecting another person. This is why masking up right now is really important and what it's about. It's adding an extra layer of protection to prevent the heartache that comes from transmitting the virus to others. We can go to the next slide. Last weekend, as you all know, we published a new health officer order requiring masking in indoor public settings, regardless of vaccination status. There have been some questions about applying the guidance in this order in special situations, so I just want to take a moment to answer some frequently asked questions. In crowded outdoor areas that are partially enclosed by walls, respiratory viruses are transmitted more the way they are inside than the way they are in wide open outdoor spaces. For this reason, the masking requirement applies in these partially walled areas of outdoor venues, like concourses and concession stands. At larger gatherings and event spaces, such as at hotels or event halls indoors, masks are required. Similarly, masking is required indoors at houses of worship. And while we don't require masking at private gatherings, in your house, if we are recommending, if there are unvaccinated or immune compromised people are present, please think about universal masking in these scenarios, particularly if you're indoors, as a way to protect everyone. Meanwhile, if you're eligible for a vaccine but have not yet been vaccinated, please consider getting vaccinated now. As we approach the start of the school year, the best way to set ourselves up for successful school reopenings is to get as many teens vaccinated as possible. And right now, as I showed you, only 39% of teens 12 to 17 in LA County have received one dose of the vaccine. If you're a teen or you're a parent of a teen and they can get their first dose today, they'll be partially protected within a few weeks and fully protected by early September. We also want to do everything we can to get vaccines out to communities that need them. And we have a robust system of mobile clinics, which you can invite out to your work site, house of worship, or community event. And as always, if you want to request a mobile clinic, you can go to ph.lacounty.gov, and then you can click on additional resources at the bottom of our vaccine website, and it will take you to find a vaccination provider for your organization, which takes you to a form, and that takes you to having us send a team to your site. The vaccines are not perfect, but I think as I've shown today, they're an excellent protection from COVID. We choose on a daily basis to protect ourselves using imperfect methods. For example, while seatbelts don't prevent every bad thing that can happen during a car accident, they do provide excellent protection, so much so that we all use them routinely. It wouldn't really make sense to not use a seatbelt just because it doesn't prevent all injuries from car accidents. I like to think about COVID vaccines in the same way. Rejecting a COVID vaccine because they don't offer 100% protection really ignores the powerful benefits that we've experienced for those people who have in fact gotten vaccinated, and for our community as a whole, as we've been able to reduce transmission with higher rates of vaccination. I know that this isn't the only barrier for many people, and that there's still a lot of rumors and bad information circulating about vaccines. For answers to some common questions about vaccines, you can visit your primary care doctor or check out our webpage addressing vaccine misinformation at the resources section on our website. I'll go on to the next slide. We're so grateful to everyone who does their part to protect themselves and their communities, and we continue to be able to extend thank you gifts to residents who come in to get vaccinated. I want to express my gratitude to the many partners who are working so hard to improve vaccination coverage across our county. We appreciate the support of our sports teams, event venues, and local attractions in helping to encourage those not yet protected to get informed and get vaccinated. Beginning tomorrow through next Thursday at all of the county-run vaccination sites, the LA City sites, and St. John's Well Child and Family Center sites, everyone 18 and older coming to get a vaccine has an opportunity to win one of 7 packages of tickets to an array of concerts that are presented by. We greatly appreciate the generosity of our partners at AEG. With their support, 7 lucky people and a whole lot of their friends will get to enjoy both protection by vaccination and some exciting shows at terrific LA County venues. You can see the official rules on the county website for details. And over the next week, we ask that you try to make some time to get your vaccine. Thank you. And now I'll take your questions.
Our first question will come from Patrick Healy with NBC Los Angeles.
Hello, Dr. Ferrer. A lot to digest this week. At 20% of all cases in the vaccinated, it also appears that the percentage of people requiring hospitalization is increasing. To what do we attribute this? Is Delta actually continuing to evolve so that it is even more contagious and more virulent? And then, if I may, a couple of more, looking at the county data, I noticed there are extreme hotspots on the west side, Beverly Hills, West Hollywood, and the Hollywood Hills. To what do we attribute that? A number of bars are now requiring vaccination proof. Is that something you would consider making countywide requirement? And finally, vaccination rates still remain low among public safety workers. How important is it to get those vaccination rates higher? Thank you.
Yeah, thanks, Patrick. Let me just start at the beginning of the list. It's a great question that you're asking about. Is the Delta variant actually evolving and creating even more problems for us? And we don't actually have a definitive answer on that. I will, however, say that when you have a more infectious variant that's circulating, and you see what we see now, lots of community transmission, you can expect exactly what we're seeing. Lots more people getting infected, including more people who are fully vaccinated. So when we had very low transmission, if I, as a fully vaccinated person, was in a room with a lot of unvaccinated people, but only 2 of them were infected, my chances of getting infected were really, really small, even if it was the Delta variant. But if I'm in that same room with a lot of unvaccinated people, I'm fully vaccinated still, but instead of 2 cases of people who are infected in the room, there's now 30 cases of people who are infected in the room. My chances, even as a fully vaccinated person, have just gone up. So partly what you're seeing is when there's more community transmission, it affects most prominently everybody who's unvaccinated. You have the highest risk of now getting infected, but also even for those who have the protection of our vaccinations, which still provide a lot of protection against getting infected. If you've got like more people around you that are infected, you've just increased your chances, even as a fully vaccinated person, of getting infected. But one of the reasons why, weeks ago we were recommending people keep their face coverings on is the Delta variant is a game changer. And as we learn more and more information about the Delta variant, we're recognizing that it creates additional threats to everyone in our community. So, hopefully people can go ahead and comply with our directive to please keep your face covering on when you're indoors, whether you're vaccinated or you're not. I agree with you, Patrick, that there are hotspots. Some are on the west side. There are some in other parts of the county. We're working to actually identify what may be the sources of some of the increases that we're seeing. I mean, one thing for certain is in places where there's a lot more intermingling indoors, so that would include, in particular at bars and nightclubs, where people may not be wearing their face coverings, we're going to see more transmission of this virus, particularly with the Delta variant. And in communities where people are now intermingling at much higher rates than they might have been before, and we still have, as we've noted, lots of people not yet vaccinated, we're going to see these increases. We're going to be working, obviously, closely with our supervisors about really targeting, especially around education and opportunities for vaccination in the communities where we're seeing these, as you noted, these very big spikes in case rates. I want to commend the bars that are being creative about trying to maintain their operations with as much safety as possible, and certainly requiring that your patrons come in with either proof of vaccination or that they've had a negative test result in the last couple of days is very helpful. And I'd like to just point out that, it really, businesses can help by piloting some of these strategies and seeing how effective they are at reducing transmission, particularly among your employees. We do have a number of outbreaks that have in fact occurred, worksite outbreaks that are occurring at bars. There's, again, lots of risks there for transmission if people aren't wearing their masks and they're not vaccinated. At this point in time, we're really very focused on two things: getting as many people vaccinated as possible and making sure that people are putting on face coverings when they're going indoors. And hopefully that gets us back to slowing the spread. But I do note that if you're in a high-risk setting, making sure that people are vaccinated or that they're negative is an excellent strategy. In terms of vaccination rules for, our first responders, public safety folks, I want to say that, the task right now, while these vaccines are still under emergency use authorization, is to get good information out to everyone about the vaccine safety, to answer people's questions, and really accelerate the pace of us being able to get vaccine into everyone's arms. And that's what I want to concentrate on for the next few weeks, is really making sure that people have the kind of information that they need to make a good decision about, a comfortable decision about coming in to get vaccinated. And I appreciate again that once these vaccines have been fully approved by the FDA, there may be places where it really makes perfect sense to think about mandating vaccinations or vaccinations plus testing for those not vaccinated, because there are settings that people work in where there's, really other very high-risk people that we wouldn't want to get infected. So, but right now, I think the task for all of us is really do a good job on building that confidence and making it easy for everyone to get vaccinated. We'll take the next question.
And that'll come from Jackie Fortier with KPCC.
Hi there. Could you please talk about the denominator of the breakthrough cases? I'm wondering if testing is decreasing and I guess kind of what that means. And then if you could go over, I'm sorry, there was a lot of information. If you could go over the data on the severity of the cases among the breakthrough cases. I mean, are they older people for whom the vaccines may not work as well, or do we have any demographic info on the breakthrough cases? And then finally, do you have any idea of what percentage of July cases that you expect are breakthrough?
Yeah, thanks so much for those questions, Jackie. I like to talk about this as post-vaccination cases, post-vaccination infections, because really, in many ways, the vaccines have been very effective at preventing people who are fully vaccinated from getting very sick. And in fact, we're compiling data right now that shows that if you are post-vaccination infection, your chances of sort of both ending up in the hospital, ending up in an ICU, ending up intubated are much less than the chances of that happening if you're somebody who's unvaccinated. So you're right to note that there is evidence that we continue to look at that shows that even for those fully vaccinated people that get infected, they're much less likely to get as ill as unvaccinated people, to require hospitalization and to pass away. So hopefully next week we'll have more detailed information on those post-vaccination infections, and we'll be able to share with you that detail around severity of illness. Because I agree with you, it's important to note. I'm not sure if I understood your question about, is what's in this 20%, what's the denominator? The denominator of that is all of the cases that we had in the month of June. And, I'm trying to go to that slide so I can give you that exact number, but that's what the denominator is. The denominator is the total number of cases. And so, yeah, I don't have that. I don't have that exact number with me, but what it looked at is of all of the cases that we had in June, which, I don't know, I think it was a few thousand cases. How many of those cases occurred amongst people who were not fully vaccinated, and how many of them occurred amongst those who are fully vaccinated? I'm happy to get you the actual case numbers. I don't have those numbers in front of me, but again, it's a 20-80 split. 80% of the total number of cases occurred amongst people who were not fully vaccinated. 20% of them occurred amongst people who were fully vaccinated, and then the total number is, I think, close to 4,000 cases, but I'm not actually sure of the actual number there. So we'll make sure that our team reaches out and gives you those actual numbers. So thanks. We can take the next question.
And unfortunately, we're at our time. So I don't know if you want to provide any closing thoughts, Dr. Ferrer.
Maybe we should just take a couple more questions, if there are a couple of questions in the queue, Tim, just because
Sure.
there was a lot that got presented today.
Yeah, that's great. So we'll go to Ron Lind with LA Times.
Okay.
Hi, Dr. Ferrer. Thanks so much for taking our questions. 3 questions. The first is, so, when we looked at some of your data showing, per capita rates of coronavirus cases, some of the higher areas were areas that were surprising, as Patrick mentioned, downtown LA, West Hollywood, Venice, Hollywood, Beverly Hills, Studio City, while some of the areas with the lowest case rates were places we would expect, like South Pasadena, but others were surprising, like East LA, Boyle Heights, and Pico Rivera. Wondering if you could explain why that might be. Second, the fact that white residents now have a worse case rate than Latinos is at odds with previous trends. Why do you think this might be the case? And then finally, I can imagine a lot of fully vaccinated people might freak out at hearing that 20% of all cases in June were among vaccinated people. Do we have a kind of a sense on whether many of these people were asymptomatic or mildly ill, and this isn't particularly that surprising? Is there a difference between the virus being detected and it's just in your nose versus it causing, a lot of problems health-wise? Thanks.
Yeah, thanks. Those are great questions, Ron. Let me start with the last one, because I think it is important to provide a lot of reassurance to everybody who's vaccinated. Yes, we had a significant increase in the numbers of people who were fully vaccinated and tested positive, and you're absolutely right to note the vast majority of those folks only experienced either no illness or very mild illness. Very few of them. That's why it's important to look at like how many end up in the hospital. Very few of them ended up hospitalized, and even smaller numbers ended up passing away. So yes, if you are fully vaccinated, you have a lot of protection, which is what the vaccines have always been their best at, protecting people from serious illness and death. And these vaccines, even with the Delta variant, are holding up really well. In Israel, which again, they've had a few more weeks of dealing with the Delta variant than us and have done some more research studies, the vaccines are 93% effective against the Delta variant in preventing serious illness and death. And I think we're seeing, very similar numbers here in the United States. I think it's also important to note that the more people that are vaccinated, just in terms of numbers alone, the more people who are vaccinated who will end up testing positive. So, if you increase the numbers, then you're going to just end up with more people testing positive without necessarily changing so much the proportions here. But I do think the one thing that it's important to note, although we're still looking for conclusive studies on this, is based again data from Israel, data from the UK. It looks like the effectiveness of the Pfizer vaccine against the transmission of infection to fully vaccinated people is somewhere at about 83–85%. Now that is still incredibly high. And when we went into this, the vaccines really promised us that they would prevent serious illness and death. And there were big question marks about how much fully vaccinated people would be prevented from getting the virus. And it turns out even with the Delta variant, which is, definitely wreaking havoc across our country and others, there is still so much protection for people who are fully vaccinated, especially in comparison to those who have no protection at all because they're not vaccinated. In terms of the second question that I have is sort of what are we seeing around this rise in sort of per capita cases, really surprising us in where we're finding the highest rises. And I agree with you. We've looked at this data as well. We're very grateful because we've done a lot of work in some of the East LA communities to see that we're not seeing such a significant spike there. And we're saddened that in some other communities, we are seeing these big spikes. We think it may have a lot to do with changes in people's behavior. And, again, as more people are intermingling, as they're taking advantage of our full reopening, if people are unvaccinated, and in all of our communities, we have significant numbers of people still unvaccinated, that's where this virus is going to go. And it's going to go there swiftly because it's highly infectious. So for people who are hanging out indoors, not wearing masks and not vaccinated, I think this vaccine is this virus is very quickly going to find you if you don't come in and get vaccinated. In terms of the increase that we saw amongst the case rate for white residents, again, I think we have a change in the way we're all interacting with each other. And while we have some relatively high vaccination rates in the white community, among our white residents, not high enough to prevent people from getting infected. And particularly when you start looking at this data for younger people who are intermingling a lot, if they're unvaccinated, we're going to see these increases. I think I got to all your questions, Ron.
Can we do one more?
Yeah, we can take one more.
Okay, all right, we'll go to Claudia Pescuda with KNX.
Thank you. I appreciate it. And just to follow up, I think what Jackie was asking you is how many of the breakthrough cases may have been among people whose immune systems might not react so well to vaccination? Okay, my questions. How much of a role do you think breakthrough cases may be playing in the increase in transmission? Because we're talking about increases in some groups and places that seem unexpected. And I'm wondering if fully vaccinated people may have had like a false sense of security, assuming that they were not only well protected from serious illness, but also from just getting infected and transmitting to others. Do you think it might have been helpful to put out the information on breakthrough cases as a percentage of new cases earlier to kind of get people to be a little more careful and avoid activities that could have spread the virus? And then do you think it's time to update testing guidelines so that fully vaccinated people who've had a known exposure get tested even if they have no symptoms? Thank you.
Yeah, let me start with the data issue. We have been sharing the data as we're able to clean it. I mean, obviously, very complicated and requires a lot of manual work to track down all of the post-infection cases amongst fully vaccinated people. So I want to credit our team. We're one of the first counties that's actually able to present some of this data. And we're finally able to have gotten enough data that we could look at this, not just cumulatively, which is where we've been for a while, but clean it up enough that we can assign episode dates and look at it by month. And that is why we're sharing it. But we have all along said that there have been cases of positive people amongst fully vaccinated folks. As a matter of fact, Dr. Davis presented data last week, and I presented data on this the week before. This is the first time we've been able to do such a deep dive into it. I want to thank our team here for working so hard on that. They actually interviewed about 2,000 people who had been fully vaccinated and were now infected. And in that group, so that's about 50% of what we had been reporting on. In that group, we did not see a very big difference between fully vaccinated and unvaccinated people in terms of comorbidities. So they pretty much both looked similar. But that, again, it's not the full group. It's just a small sample of that group. But we didn't find this issue that, more of the people who were seeing post-vaccination infections were in fact seriously immune compromised, not in the small sample that we looked at, but again, we'll keep looking at it to try to get a more complete picture. So we're sharing the data as soon as we have it in a form where, we can feel like it's very reliable, people can count on it. And as everyone is noting, I mean, what we really saw was this very big increase. And yes, we think the numbers can go up again in July because there's just so much more community transmission. And that's going to, no matter what, just translate in higher numbers for both unvaccinated people, where it'll be the highest, and then some smaller increases amongst vaccinated people. But yes, those numbers will go up until we get community transmission back under control. And hopefully, masking is going to get us there more quickly. So thanks for that. And I'll turn it back over to Tim. Again, want to appreciate everyone. I know this was complicated, so if we didn't get to your question, please go ahead and send it in. There was a lot here today, and we apologize for trying to get in so much information, but this is the first opportunity we've had to really talk about what we know about post-vaccination infections. So we wanted to present what we already have and what we already know today.
Thank you. And to that, if you do have a question, I know there were a lot today, you can send an email to media@ph.lacounty.gov. Send that today, and we will get back to you as quickly as we can. We will make Spanish remarks. We'll begin that in about 5 minutes. Monica, are you all set?
Yes, I can.
Okay, give me 1 second.